Good morning and welcome once again to the Elephant's ongoing series of discussions with key African intellectuals on the COVID-19 pandemic, its implications socially, politically, and economically. And this morning I'm very lucky and pleased to have my friend Dr. Alex Awiti, who is a resilience ecologist, specialist. So this is really your time, Alex. We're coming to you for wisdom. Alex is also Vice Provost of East Africa at Aga Khan University and founder of, I think, the Media Hub, which is also now a key part of the Aga Khan University. And it's great that you found time to join us. I can see from the room that you're sitting in that this is not your usual well-appointed office where we meet. So I wanted to ask you first, how's lockdown treating you, the family? You're well, you're safe?
We're well and safe. Thank God for that. Working from home. As you see, I have my little study room here. This is something that, just as you said for the elephant, we didn't anticipate that we'll be using it so often. So this has become my second home now. But I think on a personal note, this is taking a huge toll because I think we're working longer hours than we normally do on an 8 to 5 basis. Because a lot of my colleagues are trapped outside of key geographies and in North America. So the time difference sometimes requires that we start working as early as 6 a.m. in the morning and sometimes wind up finishing work at about 10 p.m. in the evening.
Yes.
So I guess it's lockdown with much longer hours and a lot of kind of crisis type meetings and decisions to make.
Yes. Well, I'm glad you're keeping well. Give me a broad layout, Alex, as you know, you're a resilience specialist, and there's a sense in which there's nothing as dramatic that tests the resilience of a society, of an economy, of a political system than a pandemic of this nature, especially given the measures that we've implemented to mitigate it, that have locked us in our rooms, in our homes, have limited social interaction, travel, etc. And I wanted to get your readout, just your broad readout of the implications of this from your particular perspective as a resilience specialist. If you can just start with that general question.
So one, John, thanks for that question. It is the element of surprise and uncertainty that really underlies this kind of pandemic. I think in many ways, when the first case was announced was diagnosed in China in December, the rest of the world didn't imagine that this was going to happen on our shores.
No.
We didn't realize that people would get on a plane, it would be the Chinese New Year, and people would be scattered all to the rest of the world. And so the world was caught napping in a sense. We didn't understand what this means. I think we were thinking back to the SARS situation way back then, which was not a pandemic. We didn't realize that given the travel, the technology that we've developed, we've stitched the world into one village.
Yes.
And then it was easy for this disease to then move from continent to continent. So the element of surprise is a critical core formulation principle in resilience types of in events that require resilience. The other one is the dramatic shift to what we may call a new dynamic, to a new attraction point, which is the response. And as societies have responded in different ways, the uncertainty kicks in. And just the fact that there wasn't enough information, enough data to then guide decisions. And one of the other elements of this that makes it a classical resilience response type of situations is that we had very fast-moving components of this pandemic, and that is the infection rate and the number of people that could be infected in a very, very short period of time, and how economies had to go into a different mode. China started by a lockdown which lasted 70 days, for instance, and then we had South Korea, we had Japan, we had Singapore, and the pandemic moved to Europe after Asia, and then we saw elements of that into North America. So I think in the way that it's kind of moved around, the element of surprise is huge. The fact that the very fast components of this that are interfacing with very slow kind of institutionalized mechanisms of global commerce, airlines, and we've seen the reluctance and sometimes the skepticism that we saw with the Trump administration, where they say, well, it's going to be just one case, and boom, New York erupted. Seattle basically came out slightly scathed, and then we see New Jersey, we see the tri-state of North America, and then we see Europe, Italy, and then Spain, then we see the UK, and now we see Latin America with Brazil, then Ecuador, and Peru, and so that to me is kind of the real hallmarks of a situation that requires us to really think about reemergence on the other side. And that's a key principle of resilience. How do we reemerge on the other side in what we call an alternative stable state? And as I said, it's not post-COVID, it's just an alternative state of the global institutional order. Whether you're talking about social norms, whether you're talking about institutions of governance, whether you're talking about economic modes of production, for instance. So it's really that readjustment to an alternative state, which is not optimal, but just a variant of the previous state. And how reconfigurations happen at different levels then become the conversation that we must have, as a country, as a region, and then as a global community in response.
So there shall be no post-COVID in that sense. And perhaps it's a term we've been throwing around as if we are on some enforced holiday, and at the end of this, the date will be announced when life can go back to normal, we can go to the offices, and et cetera, et cetera. So this becomes like a big reboot that society has had. And you're saying that's not the case. The change has already happened and it shall persist.
Yeah, so we've seen, so what is interesting in the global conversation on reopening economies is what I might call randomized control trials. So you saw Mississippi in the United States roll back the announcement by the governor to reopen the state when the COVID cases surged. We've seen Italy basically kind of playing around with the idea of reopening, and yet the death numbers are still rising. We saw the surge in Singapore, which happened in the dormitories of migrant workers when they thought they dealt with the disease. We also saw South Korea with a new spike. So what we're learning from this is that, well, there will be new ebbs of this disease. What we might not see is the all-out global scale surge of COVID cases. We'll have new epicenters in tiny places. We've now seen 2 cases in Bungoma, for instance. Might that be Kenya's new epicenter outside Kwale, Mombasa, and Nairobi? So this is what we're going to see going forward. So, and that's why I suggest that we're moving to an alternative state. Relative to the normal, it's just an alternative state. And in that alternative state, it means that we have to do all of the things that we're doing now to basically deal with the disease. Face covering, for instance, with face masks, social distancing, for instance, and various what we call non-pharmaceutical interventions that governments are basically instituting. Yes, we will still go back to air travel, but it might be that you need an immunity certificate. You must show that you have the COVID antibodies. Airlines might reconfigure how the cabin seating happens, where those who've contracted the disease will sit by their own, on their own. If they have, of course, they would have contracted the disease and recovered. So we hope that they're immune to the disease. Those who have not contracted the disease will have to sit in a different place with new arrangements of seating. So you will see the economy trying to map the old model, but it's an alternative mirror of the previous pre-COVID state. But it's not that we've reemerged out of COVID. We just have a new stable state, and we have to realign institutions, travel, as well as the economy to conform to the norms of that new state. So the rules will be rewritten in a COVID coping economy. We have new rules in that new economy.
Thanks. Kenya has always prided itself, or let's say our elite has always prided itself as a traditionally very resilient society with considerable capacity to absorb adversities, mainly political, but also natural ones in the past. What would you say is the scale of the challenge confronting our institutional infrastructure now, both political, economic, social, health infrastructure now, and what we all know the raft of measures that have been implemented. In Kenya, we're now walking around with masks. We are talking to each other this morning from home. So we have lockdown, we have travel restrictions, we have borders closed, etc., etc. And so a number of major changes have already taken place. And what I wanted to ask is, is there anything unique that we can learn from previous Kenyan responses to disasters, to challenges like this, not at this scale, and as somebody who has studied this subject, what are the lessons from the past vis-a-vis Kenya that we can perhaps learn from as we grapple with this particular situation? Are there any Kenyan peculiarities? One of the things that I've heard repeated is that the methodology that has been implemented for the template that has been implemented to mitigate COVID-19 pandemic is a bit of a template from some of the countries that you mentioned, and is anything unique that we need to do as Kenyans? And then I would also finally we just want to get your comment on what's happening in Tanzania, which seems to be very different from what's happening in the other East African countries in terms of approach.
So, John, we've been through very tumultuous times, and the one that comes easily to mind is the 2007 election and the violence that obtained around that.
Yes.
And the conversation around move on, which basically means that we just go and pick up from where we left.
Yes.
Now that's a dangerous attitude, and that's not what you need for something like this. We can go back to normal. I don't think that wearing masks, social distancing, and some of these temporary kind of structural measures to close down restaurants and to reconfigure sitting arrangements and have restaurant staff be tested for COVID regularly, those are not going to change. But I think what we need to think about is that we're not going to go back to business as usual very, very fast. Unless we do two things simultaneously. One is that the government pushes all of our precious resources to what we call syndromic surveillance, to testing at the grassroots and using our ingenious healthcare system design with community health centers, dispensaries, etc., going forward. Because what we've learned from other societies is that these pandemics cannot be treated using the dominant Western healthcare model that is patient-centered, medicalized, and hospital-based. It's not worked. In Lombardy, in Italy, where this disease pummeled the hardest, is one of the wealthiest spots on the planet.
Yeah.
And all these wealthy people were dying on the streets waiting for a ventilator machine. And everybody now is convinced that that was not necessary, that we needed to figure out an alternative way, community-based, population-focused approach to healthcare. So the government needs to do that. And it's good to know that some of these efforts are underway, because we cannot go back to anything that approaches move on until we know the status of everybody in the society. One of the things that I hear from people is that they just don't trust other people, period. Even if I see you today and I see you tomorrow, how sure am I that you've been taking care of yourself? And today you're negative, tomorrow you might be positive. So how do you trust even your colleagues in the office? How do you trust the person sitting next to you in a matatu, the person in the queue in front of you in the bank, etc.? So I think that move on mantra, that move on logic will not work for us in this situation. So as we wear this down, as we push for time for the government to basically go out there, find and isolate all the positive COVID cases and get them the care that they need, we need to understand that the dominant logic for our society has changed. It is an intensely social, high contact society needs to move on to a very different reality until the cost is clear. And the cost will only be clear if we have a cure for the disease or we have a vaccine, or both. It is only after that that we can go back to more or less trying to move on. So I think that we can learn from the 2007. The lessons we can draw from that is that we will always rise up, that we cannot be beaten down as a people. We have an indomitable spirit, and we are so enterprising in all the things that we do. And I think there's been a tremendous creativity and innovation in the population. We are very adaptive. We're very accepting. Kenyans are not whiners. And I think that impatience in when can I get on with my life is important, but it has to be tempered with a lot of caution that suggests that this is not business as usual. This is not you having a fight with your neighbor and then the next day you can shake hands and sing kumbaya. Yeah. This is a highly infectious disease, and it is going to be very difficult for us to restore the confidence. And I've seen in other communities, in other societies, the government is saying we're easing down lockdown measures, but people are afraid to even venture out into the streets because they're going to get sick. And now families have to make thousands of very complex personal decisions when the government has basically said you can now go out. Now, how do you evaluate that? How do you evaluate the risk for yourself and your family before you venture out to go to a club, before you venture out to go to the supermarket, before you venture out to send your kids to school, before you venture out to even go to hospital to find the care that you need for your sick loved ones? So I think this is something that we need to think about, even as we frame kind of a return to business as usual, but under the COVID logic. Tanzania is a very interesting case, and I think a lot of people are grappling with just the characteristics of this pandemic. I'll give you a very good example. Iran has over 90,000 cases today, close to 100,000 cases today.
Correct.
Iraq neighbor has very, very low, almost near negligible fatalities, even if they were not tested. Okay, but people are not dropping dead on the streets. Iran has very high fatalities, maybe about 8,000. So it is very interesting how this pandemic has evolved in our societies. We're sitting here, Uganda is sitting on very low numbers. Our neighbor Tanzania has surged to 480. Kenya has got its own numbers rising to 436 now and moving forward. Burundi has very few cases. Even if they were not testing, there were people dying on the streets, etc. So what is interesting in Tanzania is it's an audacious, I hope deliberate plan by President Magufuli to basically try and tempt fate enough to build herd immunity in his population. And basically just say, I'm not going to lock down, but I hope you're going to use your common sense. But when you see some of the crowding at Kivukio, that ferry, you get horrified. And it's no wonder that the numbers surged just after that. And people are talking about the government not being very straight with the numbers and the cases must be all over the place and all of that. Kenya's taken a very different turn, which is also very different from Rwanda, for instance, which is in total lockdown.
Yeah.
You have to get authorization via an online platform for the government to give you an e-pass to get out, and it has to be very specific. What are you going to do? Because groceries and vital services can now be procured online and delivered at your door. So I think, and Museveni is the same thing. He's tried all kinds of things, basically to make sure that people don't move around. So governments have responded very differently, and even after this first surge, societies are going to reemerge at a different equilibrium. And that's what is going to make it very difficult for us to stitch back the East African cooperation because of that mutual suspicion. Because Tanzania, people are going to feel that, well, we don't know the scale of your pandemic. You've been all over the place, you're not testing, you're not doing all of that. Rwanda, Uganda, and Tanzania and Kenya are moving on with credible, measurable mechanisms to stem the pandemic. So it's going to create a lot of distrust across the region. In Somalia, where there's no government, I don't think anybody's going to let them into the country. So people will sit down around the table and basically say, well, I don't trust you, so I'm not going to open my borders and do trade with you. So I think all of these things are going to play differently and are going to change the dynamic of relationships between countries, and especially amongst ourselves here in East Africa.
That is fascinating, because I was watching this weekend, Alex, and you might have seen it, an interview that President Museveni, he's been very proactive in taking a lead in managing the communication to the Ugandan people around this COVID-19 pandemic in Uganda. So he's on TV often, he's doing press ups, sometimes, and it's proactive, and it's for me it's Yoweri Museveni at his best. He's a whatever weaknesses he has, he's a tremendous communicator in times of crisis. And I was watching him this weekend, and when in his typical sort of clever use of metaphors, he described East Africa as ordained to be united by God, and if Uganda is a bedroom, Uganda and Congo are bedrooms, then the front rooms, the sitting rooms, are Kenya and Tanzania, and the point he was making was that to get to the bedroom, you have to pass through these living rooms. Yeah. And so he was making perhaps the opposite argument to the direction that you've just described. He's saying that actually perhaps never has East African cooperation been more urgent than it is right now. That unless we deal with this together, we're all going to be boiling in the same pot of soup, because we are so interconnected, so interlinked by trade, by commerce, by a huge, vast network of informal and formal relationships, from the personal to the institutional.
Yeah. So I think his point is well taken, but we have to have joint strategies in dealing with this pandemic. And Tanzania has been cited by WHO for not really playing by the global international standards for dealing with the pandemic, the non-pharmaceutical interventions, the social distancing, the lockdown measures, and all of that. But we also hope that maybe this is how it's supposed to be. Beyond Lomberg, who is a renowned economist, has argued that, before you find a vaccine, you cannot persist in this situation indefinitely. You're going to open up the economy and let the weak die, and those who are strong enough will survive, and will build herd immunity together. And he's going back to prehistoric days and talking about, for instance, you can imagine the first flu infection in humans must have killed tons of people. Nowadays, a lot of us can go for several years without contracting a cold until another very new, novel cold virus appears in the population. Then you pick it, you build immunity, and you move on. So you keep assembling your arsenal of immunity to different kinds of flus until your last day. And I think that is one dimension, but it is a perilous dimension. It is very high risk, and I'm not sure that the rewards are equally high. Because one of the things that has happened, they compared Sweden, that was in total lockdown,
Yes.
and they compared that was not in total lockdown, and they also compared other countries that were in total lockdown, and per capita expenditure at a family level had declined by the same amounts. Household spending had declined by 80%. In Sweden, neighboring countries that had not been had been in lockdown. So humans just themselves, there's just a tremendous signaling of safety that is inbuilt, that is inherent. We are built for self-survival and self-preservation. So even in Tanzania, I'm sure there's a lot of precaution. People not all over the place, except the people who are the poor and the vulnerable, who have to work in the real economy for a daily wage to survive. And that's the same thing that happened in New York. And it's exactly the same stories that we had in 1918, when the poorest segments of New York couldn't stay at home, couldn't afford the luxury of working from home, had to risk their lives in the subway from New Jersey to downtown New York, and in the process contracted the virus and transmitted it across the New York state line into New Jersey. So again, you still see the thing playing in exactly the same ways. So we just hope that governments can provide mechanisms sufficient to safeguard the health and the lives of the less fortunate in our society, who cannot afford these isolating technologies such as you and I can afford to still carry on business as usual.
That's interesting, because the Swedish case is being cited as one that is bucking the trend, where they're not describing it as such, but it's being described as, they're going for herd immunity, which the British initially talked about and then pulled back from when the Imperial College produced a report with startling figures of potential deaths, and so there is that debate between those two models. Now, for us, you started your career, Alex. You served in the police.
Yes,
as you're one of those patriots who.
that was the second job.
Sorry,
that was the second job.
That's your second job. Okay, I did know that, but so you started. Sorry,
high school of chemistry and biology.
Sorry.
My first job was as a high school teacher of chemistry and biology.
Okay, and you went from that into the police, and here you are. Now,
Yeah.
I wanted to ask a question because of that. The model of mitigation that has been adopted in Kenya, Uganda, because it entails a lockdown, has also come with considerable securitization. Roadblocks, police are going around, stopping people, arresting people for not wearing masks, etc., etc. It's put security services on the front line. It's not health workers in the front line. It's a security services, and for me, and I'm by no means an expert, but it sort of causes me to hark back to the HIV/AIDS pandemic, where one of the groups that was particularly hard hit from East Africa all the way down to South Africa quite early was the security services, they have discretionary power, they have high mobility, and just truck drivers, long distance truck drivers were also caught up. But we also, right now we've put our cops basically as front and center of responding to this crisis. Photographs over the past week have been showing, they're the ones, taking people's temperature at roadblocks, assorted roadblocks around the country. What are the implications of that potentially? It's for the security services, for the police force and military, and what lessons can be drawn in terms of how one responds or how one enforces the measures aimed at mitigating this kind of pandemic.
So I think this is really interesting, and it's been a global conversation. When you talk about state security, when you talk about the biggest threat to global stability, the biggest threat to the existence of the state, this virus is predatory. You can see how deeply it is digging into the survival of state. It's cut revenues completely. David and I were on Citizen last week, talked about the economic impacts of this, and by David's calculations, we're losing in terms of revenues about 400 billion every month.
Yeah,
that's a threat to the survival of the state.
Yeah,
and the securitization of this then issues out of that threat. The government now looks at this economic threat and looks at humans as perpetrators of that exacerbation going forward. So it then adopts a containment mentality and basically says that you've got to rein in the humans, keep them in their boxes. Okay, and the security workers then become the frontline face of that enforcement.
Yes.
But I think it takes away, and that's why I talked in the beginning about an integrative theory of understanding how we deal with this, that it cannot be these heavy-handed security measures that helps us solve this in total isolation of the understanding of social anthropological inclinations of humans. Who are we as human beings? And somebody argued very early on that we needed to get our public health experts, we need to get our economists, we need to get our ecologists, we need to get our sociologists and anthropologists, and people who understand humans, especially when faced with a threat of this kind. That policemen coming in to just enforce the law exacerbates the pressure that we're all facing and creates more stress and more discomfort than anyone would expect. They're not creating security, they're not creating trust, they're not building confidence. They're basically painting the state as this helpless, brutal monster that basically is at its wit's end in terms of providing solutions, as not the helping, benevolent, compassionate state. And this is what we saw in the very early days of the enforcement of the curfew. And the president himself did come out and apologize. And even the police spokesman in an interview with Irungu Houghton actually apologized and said that was excessive. But you can see that's out the gate now. And the police are still doing what they're doing. Now they have extended powers to man county roadblocks, county lines. Now for the first time, when you're crossing into another county, because you have all these guys with roadblocks and mobile thermometers trying to get your temperatures and look at your papers if you are if you're exempted from this curfew and lockdown mechanisms. So we've really raised the profile of this, and we've started to create this sense of you don't belong to this county kind of a thing, and that you bring disease into our county. I think it's dangerous, and I think the state ought to be more imaginative in the way that it implements these things. We want to see our public health workers at the front line and not the policemen. Yes. You don't need a roadblock with spikes and guns to just pass a message of social distancing and obeying the non-pharmaceutical interventions. So I think we need to deploy our policemen to the things that they do the best and let our social workers, our public health experts run the show, support people, speak to them about what this means, do the education and do the testing, the syndromic surveillance that I was talking about in the beginning. This is not for the police. Right now, we should infuse the population. We should inoculate the population with good information on how to protect themselves and not brutalize them and make them unduly anxious when a lot of us don't have sufficient revenue to take care of ourselves. We don't know where the next meal is going to come from. We don't know how we're going to pay our bills. So we should not pile on that pressure and create a state of siege in the society. I think it is just wrong. We need to do this very differently.
Thanks. I mean, I'd like to just one final question, which really speaks again to one of the core areas of your scholarship, Alex, which is COVID-19 arrived, late last year, at a time when people around the world were already very exercised by the issue of climate change, what we're doing to our environment, what is sustainable, and that, as is now considered one of the great challenges that humanity faces. It's been overtaken for now by this pandemic, but that was increasingly sort of a consensus building that we cannot continue living like this. And even here in Kenya, on social media, people are sharing photographs of Mount Kenya and Mount Kilimanjaro, that because of the lack of pollution in the city of Nairobi, we can wake up in the morning and from certain parts of the city you can see these mountains. And so again, there's another lesson there. And in Europe, we have animals that have come out of the forests into the streets and are also now watching the humans. And give me a perspective of an ecological, environmental perspective of COVID-19, because even there's a lot of debate and a bit of some controversy around the Wuhan, the wet market, how this virus jumped from bats to other animals. If you could just speak to that as we conclude.
So John, that's a very interesting question. But first off, let me just say that nature has come back to claim its own space. And I've had this discussion with a lot of colleagues from the Western world who are deeply thoughtful about these things and can debate very vigorously.
Yes.
But I've made one observation to them. I've said, look at Hubei province. Look at Wuhan city.
Yes.
That is the industrial capital of central China.
Yes.
Look at Lombardy. That is the industrial complex of Italy. Look at New York, one of the most polluted areas on the planet. Look at London. So when you look at the metropolis, where this disease is kind of emerged as created epicenters, these are also the places where we have the worst air quality standards anywhere in the world. And this then compromises the respiratory quality and exacerbates the potential for respiratory diseases, for instance. And this is a respiratory disease, no wonder.
Yes.
And the fatalities have been catastrophic in these North American, European, and Asian cities. So that's one angle, that yes, we have fouled the planet. It is the air, the quality of air is so dirty, and now it's playing up in our lungs with a disease that finds our lungs as the best place to attack. Yeah. And it is just causing atrocious respiratory havoc in the human body. The second point is that this is a zoonotic disease. That means that it is a disease that escaped from animals to humans. It is very much the same as Ebola, which also can be traced. Ebola is also one of the coronaviruses that has moved from the bat. We don't know what the host animal, the intermediate host animal was, and then to humans. Because again, there was massive deforestation for artisanal mining in West Africa. And this has been well studied and is very well documented. Now, the Wuhan story now happens to be this coronavirus jumping from a bat to an intermediate animal, which is a pangolin. which is also one of the most trafficked animals in the world, taken to these Chinese markets, where humans then, and then when you confine animals under very high stress levels, these viruses then spill over. And this is very highly studied. When you put them in a cage, the stress levels go extremely high. And then the viruses can then jump out. So what we're basically, there's two things. One is the environmental quality standards of our air. And the other one is just how predatory we have been as humans on natural environments and creating this possibility for viruses to then spill over. So there's a deep environmental lesson to learn there. And what it has done now is to just give the earth some breathing space. So as we've looked at satellite images of nitrogen dioxide, carbon dioxide over Wuhan, Hubei. We've looked at this over New York, over Lombardy, over Madrid, and all these other places. And the air quality is clean because, again, industrial output has collapsed. We've seen oil prices going to negative. Oil now is worth nothing. And we don't know when it's going to climb out of that hole. So I think what we need to think about is how do we then twin the conversation? But again, the skeptics are basically saying, let's separate these issues. But so the UN should basically push these conversations as joint conversations, that we are as healthy as the health of our environment, that human health is inextricably bound with the quality of the environmental health, but it's also bound with our economic enterprises, that we cannot divorce these things, that ecology, human health, environmental health, and economic health have to be discussed all together. And that's why I talked about this integrative theory. How we start a conversation that is not overly dominated by people who count widgets as net products of an economic output. What about human lives? What about the quality of human lives in this conversation? So I think there are deep lessons for us to learn here going forward. How do we simultaneously continue the conversation on dealing with the pandemic, but also go back to the deep conversations, the unfinished business of the Paris Agreement on tackling climate change? And basically this reduced industrial output is going to pain a lot of people. And the reaction naturally is going to be for us to ramp up industrial output, soak in more carbon to create economic product, and then go back to the pre-COVID to the pre-COVID days of industrial output, industrial pollution. I think that would be a mistake. We hope that certain models of economic enterprise that have helped us cut carbon footprint will be institutionalized, working from home and limiting commuting, using more online models of shopping and productivity, that we might actually then reset the balance between nature and humans.
Thank you very much, Dr. Alex Awiti, Vice Provost for East Africa of Aga Khan University and resilience ecologist specialist. Asante sana ndugu. Thank you very, very much for making time to speak to the Elephant today. And I'm sure we'll be coming back to you as it continues to unfold. As you said, the new reality isn't coming, it's already upon us. And so, we'll definitely be coming back to you. Dr. Alex Awiti, thank you very, very much.
Thank you, John, and thanks for the opportunity to speak with the Elephant. Thanks.
Thank you.